All right, it is 12:03, and that sounds like it is time for us to get started. Hello again and welcome. Thank you for joining us. My name is Dan Callahan. I'm on the Communications Department at the Board of Animal Health, and I'll be moderating today's session. Today we will be talking about, the title I should say, is Don't Go Breaking My Heart, Prevention and Treatment of Heartworm in Canine Rescue and Shelter Operations. Your microphones have been muted. If you have questions that you would like addressed during the course of the presentation, please feel free to drop them in the Q&A box, and we'll be keeping an eye on those and get those answered for you as soon as possible. Additionally, there'll be some time for questions at the end. The recording of this webinar, as this webinar is being recorded, will be available on our YouTube channel a few days from now, as soon as we can get it up on there. And with that, I will pass the mic over to Dr. Steve Cavisto to lead our discussion today.
Yep, thanks, Dan. I appreciate that. And thank you, everybody, for taking some time out of your day to be with us. Also, thank you to my coworkers at the communications team and the companion animal program for your help and support. It's always much appreciated. So with that, I'm going to turn this off and we'll just kind of get rolling into it. So I apologize to those of you who might have quite a bit of background or knowledge in heartworm disease. Some of this will be probably review for you. For those who have little or no knowledge, hopefully this will be helpful for you. So with that, let's get started. So I guess the big question is, right, what is heartworm? And as the picture on the left shows you, as the name would imply, it is a worm that lives within the heart of dogs, and typically it can inhabit other canid species, and we'll discuss later on also some of our other mammalian species, but dogs are certainly the major host for heartworm. This is probably an extreme example of heartworm in a dog. We're talking hundreds of worms in here. And typically, in your average case, you're probably looking at a dozen, maybe a couple of dozen of worms. But they can grow up to 12 inches long, at least the females can, and can live anywhere to 5 to 7 years within the heart of the dog. So, which can be troubling. You can imagine having this many worms crammed into that space doesn't allow much for blood to fill up the chamber or for the normal function of the heart. On the right-hand side there is what is basically a baby heartworm or microfilaria. It's a larval stage. It's the first larval stage, or the L1, that the adult heartworms produce, and they circulate through the blood, and that's where the mosquitoes come in and pick it up. But we'll get into the life cycle a little bit more, well, quite soon, actually. But I will just add that in the lifespan of your average heartworm, it can produce millions of these little microfilaria. And so you can imagine if you've got a high population area with mosquitoes and dogs, that contracting heartworm could certainly be, well, quite likely in that scenario. The American Heartworm Society, and before I forget, I'll mention multiple times, they have a great website with a ton of information on heartworm. This is as far as I could tell, the latest map or incidence map that they had. And you look in I guess no surprise, the southern states down in this area here, your higher density areas of heartworm. It's warmer, they have mosquitoes in some areas year round. So it's not surprising, add into the fact that prevention is probably not used, not used as frequently as it is in some other parts of the country. Then you've got a recipe for a lot of heartworm. It has been found in all 50 states. The glaring state missing in this map here would be Alaska, and I think that's for one of two reasons. One, it's big, and maybe they couldn't fit it, and two, from what I understand, they believe most of the cases that they have detected in Alaska were from dogs that were imported into or moved to Alaska. So they came in with it. So they're not necessarily certain they picked it up there. So just kind of starting with the basics then with the life cycle. And in the next couple slides after this, we'll get into a little more detail each slide. We'll start at the top here with this poor looking dog. I should say poor dog that is positive with heartworm. It has the babies circulating within its bloodstream, these microfilaria, and a mosquito comes along, takes the blood meal from the dog. The larva, the L1 larva, the microfilaria, will mature within the mosquito, and then that mosquito will go on to the next dog and bite that dog, feed on it, transmit the larval stages into that dog. They will mature for a period of time within the tissues of the dog and find its way into the right side of the heart, and that's where they will complete their life cycle. They will grow into complete adulthood, they will mate, and then they start producing babies, those little microfilaria, and then the cycle goes through again. And before I forget, can people see my little pointer going around in circles like that? I'm going to count on you, Dan, to
Yep.
answer that. Great.
Yes, we
Thank
can.
you. Thanks. Appreciate that. So a little more details then. Transmission. Okay, well, we'll start again with the microfilaria. So the L1 larvae, so the microfilaria, these are the ones that are first born. They're little babies. They're in the blood of the dog. The mosquito comes along and picks it up. And those L1 larvae then within the mosquito mature a couple molts, if you will. They go from an L1 to an L3, and that takes a couple of weeks. From there, then that mosquito goes on to the next dog. Once these larvae have matured, bites the dog, transmits the L3 larvae into the next dog. Those L3 larvae will molt into an L4 and L5 stages. And while they're doing this, they're traveling through different tissues of the body. Once they get to an L5, kind of leaning into the L5s will sort of work their way to the heart, where they will complete their transition into adulthood. And that's over about a 6-month period. They will mature into an adult and then again start reproducing and pumping out those L1 larvae, the microfilaria, into the dog's bloodstream. Some time frames then, where and how quickly this occurs. And again, Dan, if questions pop up that seem pertinent at the time, please feel free to interrupt me, and I'm more than happy to answer them as they come in too.
Will do, sir.
Thank you. So once the L3 larvae are transmitted to a dog, it takes 3 to 4 days to go from an L3 to L4. And then from an L4, it takes 50 to 70 days. So up to 2 months or just over to go from that L4 to an L5. And then I should say, into an adult. It takes up to, again, another 4 months to get into that adult phase, so up into the sexual maturity. So all in all, from start to finish, it's anywhere from 7 to 9 months, but as early as 6 months, you can have an adult worm. Which is why if you get a dog who is bit by a mosquito today with those immature larvae, if you tested it today or tomorrow or the next day or a couple weeks down the road, they're going to be negative because we need an adult worm in the heart, an adult female specifically in the heart in order to be detected on your antigen tests, your typical test that they'll run in the vet clinic. And maybe even a little bit longer for the microfilaria to show up in the bloodstream to be detected. So that's where these time periods are important. And the other time I would say is also very important is this L4 to an adult. That period right in here is where the preventatives that we give, like Heartguard, Interceptor, whatever you happen to use, that is where they will come in and they will stop the cycle. They will kill those larvae stages before they become an adult. When they get to be an L5 and then in a full adult, the monthly preventatives will no longer kill them. They won't take care of the adults. So we have a little leeway. We typically most preventatives are recommended once a month, every 30 days. There is some squish factor there. Now it says here 50 to 70 days. I would say most manufacturers, well, first of all, they probably won't want to tell you there's a squish factor. But I wouldn't say anymore. As in practice, 6 weeks was the tops that I would recommend anyone. Um, well, never recommended they intentionally push out a dose that far, but if they happen to go that far, they should still be covered and be safe there. Let's see if I can get on to the next slide here. Okay. So prevention is the key with heartworm. We'll talk about treatment a little further down the line, but prevention is way easier and much safer. The trick with heartworm prevention is that it is different than your average flea and tick product, right? You put a flea and tick product on a dog, topical or oral or whatever, it's working forward. So a tick that wasn't on the dog starts crawling on the dog, whether depending on the product, it either feeds or just crawling through the fur, it dies. And so that animal is protected going forward. Usually it's what, a month roughly, for most preventatives. The difference with heartworm prevention is it works backwards. So when that mosquito bites the dog, injects the larval stages, um, you give a heartworm prevention, once a month, 30 days later, it wipes out those larval stages before they become adults, so that it kills them after they are in the animal. It stays, so depending on the product, for instance, such like most of the oral ones, they'll stay in the blood for 3 to 4 days, but not much longer, and that's probably tops. So they're not working forwards; they're working backwards. And again, the other important part of this is that you've got to catch it at the right stage. So that's where that recommendation at 30 days, because after that, when they get into that L5 adult stage, the preventatives are no longer effective. The oral ones do have some limited activity against the L1 or the microfilaria. So that first stage, the adults produce before the mosquito comes along, but they are not a microfilaria side. It's not something that you can give a dog that's going to wipe out all of the microfilaria in their blood and make them non-infectious to a mosquito that comes along. Same with the injectables. They work a little differently though. You give an injection, and depending on the type, they last anywhere from 6 to 12 months. It's a reservoir, if you will, stored in the fat tissue, and it's slowly released over that period of time. And so that you don't have to worry about missing doses, right? Because it's consistently being, I'll use the term, bled into the bloodstream and killing the new microfilaria, or I should say the L3, L4 stages as they come into the dog. And then topically, so moxidectin, and I will tell you the one brand name, Advantage Multi, is the only product out there that is FDA approved to kill the microfilaria, so those L1 larvae. And it's also heartworm prevention, so it'll kill those L4s as well. Um, it has a couple added bonuses. I don't work for Bayer, but I will say it also does have the ability to repel and kill mosquitoes. So there's another bonus in preventing heartworm disease there. Another topical, selamectin, Revolution. I know there's a generic version out there right now. Apologize, I don't know the name. Um, is also another topical heartworm prevention, but it does not have a label as a microfilaria side. So of all those ones I mentioned, the only one that is labeled to kill microfilaria is the moxidectin, the Advantage Multi. And in case I forget to mention it later on, and I don't think I will, but in case I do, The oral ones they do have some ability to do so, but we're talking, 70-75% of the microfilaria killed versus nearly 100 with the Advantage Multi or the Moxidectin. And when you're talking about millions of microfilaria, that's a lot that are left. Again, talking about the American Heartworm Society, some of the information they have, there's a lot there. One of those would be this guidance document on prevention. I won't read it verbatim. I'll just kind of hit the highlights. The macrocytic lactones, which is basically all of the products on the previous page, or Heartguards or Interceptors, the Selamectin, the Moxidectin. These are the only classes of drugs that are FDA approved as heartworm prevention. And when used at the labeled doses, they are extremely safe. The American Heartworm Society recommends year-round prevention. So regardless of whether you live in Texas or Minnesota, they still recommend year-round prevention. There's a handful of good reasons. I won't make an argument strongly for or against. I'll just say that between snowbirds traveling south for the winter, our winter's getting shorter and warmer. It's easy to make an argument, I guess I just did, to use preventatives year round. Some people just simply like to do it because it's easier for them to remember to do it that way. But the American Heartworm Society does recommend doing it year round. There has been some documented cases of true resistance of heartworm to these oral preventatives, the macrocytic lactones. Some of those cases can be traced back to poor compliance, missed doses, doses not given at all. But there have been some true cases of resistance documented. So it does happen, it can happen, it is happening. To date, as far as we know, there aren't any resistant heartworms in our area. They seem to be, knock on wood, kind of down in the Mississippi Delta area, southern states. So, and hopefully it stays that way. It just that kind of depends on how we use the products and how careful people are remembering to give it on a regular basis. The other thing it also mentions in here that I honestly never really thought much of in private practice is just keeping the mosquitoes away. So if you keep the mosquitoes off your dog or you reduce the mosquitoes in the environment, that is also going to help prevent heartworm, not just for your dog, but for others, and also to help keep it out of any wildlife reservoirs. So again, I wasn't a huge fan of topical heartworm prevention in private practice. I guess the more I dig around and more I studied and to make this PowerPoint, I guess I feel a little differently about it than I did previously. So going back to microfilaria now, and this is important when we're talking about we're bringing animals up from down south that are heartworm positive because they have these microfilaria circulating in their bloodstream. They're potentially infectious to the dogs that are living up here already. So these microfilaria, once produced, they can live in circulation for up to a couple of years, which is a significant period of time. The oral heartworm preventions, again, they can kill microfilaria, but they do so incompletely, especially at the doses that are found in most preventatives. I'm going to use Heartguard as an example. It's pretty commonly known. There are some generics out there, but the drug in Heartguard is ivermectin. And the dose of ivermectin that is in a Heartguard tablet is extremely low. And in fact, low enough where those dogs that are sensitive, the MDR1 mutation, dogs that have the genetic mutation that makes them sensitive to ivermectin, you're thinking your herding breeds, they can take Heartguard safely and they won't react to it because the dose is so low. However, the dose of ivermectin that is needed to completely kill off microfilaria in the bloodstream is 8 times higher than that's found in Heartguard, which is still It's safe if you're dosed it correctly in your average dog, but in these ivermectin sensitive dogs, it is not safe. So that's important, an important factor to keep in mind as well. So unfortunately, many people make the mistake of thinking that they've given their dog, given a dog a heartworm tablet. Um, they should be microfilaria free and therefore not infectious, but that would be, well, a mistake. That is not the case. And the other thing, let's pretend for a second that it was the case that you gave that dose of Heartgard and it eliminated all the microfilaria that were in that dog. It didn't kill the adults, and they're still making those microfilaria. And if that Heartgard only stays in their system for a few days, in 2 to 4 weeks, those adult worms will have produced enough microfilaria to be detected on a blood test again. So, again, hypothetically speaking, a dog down south that's positive for heartworms given a Heartgard tablet and shipped up here, within a couple of weeks, it could potentially have microfilaria circulating again unless something else was done. So, I don't own stock in the company, but you'll hear me mention it multiple times, and it's because it's the only product that is USDA approved to kill the microfilaria. Advantage Multi will kill it and stays in the system for 30 days. So it doesn't just kill the ones that are there, it's going to kill the ones that are continuing to be released into circulation by the adults. I will add though that it also does not kill the adults. So, and I kind of alluded to why this is important. Um, because if you, again, you give that dose in a dog that's positive for heartworm and you believe that you've made it non-infectious, it's just simply not true. So if your goal is you're going to bring a dog up from down south that's heartworm positive, hopefully you're bringing it up here to treat it and then adopt it out. A couple of things you can do to make that safer for, I guess I will say, for the population of dogs that are up here already. One is to apply the Advantage Multi. It will kill those microfilaria. It will also repel mosquitoes. So in two different ways, we're keeping those babies from reaching another host. And then the other would be to start the dog on oral doxycycline. Now, both of these would need a relationship with a veterinarian at the site of origin, which you, as you recall from previous webinars, if you were here, will remember that is necessary in order to obtain a certificate of veterinary inspection in order to import into the state of Minnesota. So you've got this relationship established, or someone does down south with a veterinarian, and they can get these things rolling before they make their way up here. So if they can get the Advantage Multi applied and they get the dog started on doxycycline, that's just really makes the odds of that dog able to transmit heartworm to the mosquitoes up here and therefore into another dog. You never say never, but slim to none. And the theory, for those who don't know, behind doxycycline is there's a bacteria called Wolbachia that is a symbiote. It means it lives happily with heartworm and they are dependent on one another. And so when you kill the Wolbachia bacteria, it makes the heartworms, the adults, weaker. And so it can reduce the number of microfilaria they're producing, and it can also affect the ability of those microfilaria to mature into the L3 larva within the mosquito, which therefore makes them basically ineffective. So there's definitely some advantages there, but using those two products at the same time. But again, it would need an established relationship with the veterinarian. So going back again to the American Heartworm Society's website, they have a ton of good information. And one of those things they have is this document called Minimizing Heartworm Transmission in Relocated Dogs. And it's kind of, it's small on my screen and maybe you can kind of see some of their um, if this, then this kind of layout of this particular document. But basically, if you navigate to their website, you see For Veterinarians tab, the veterinary education, and then you'll find this document there. it will discuss what do you do if the dog is heartworm positive and has microfilaria? What if it just has it's just heartworm positive without microfilaria? So it goes through multiple different scenarios on how to make it um, both again safer for the dogs up that are already here, plus safer for the dog in transport. So one of the things with killing microfilaria is that it's within the bloodstream of the animal, of the dog. When you kill these microfilaria, I mean, they die. That's the purpose, right? But they're still in the bloodstream, and it is not uncommon, or I should say, unheard of, for dogs to have any allergic reaction or anaphylactic reaction to dying microfilaria. So, which makes it all the more important to have that relationship with the veterinarian at the site of origin and to do these things, to give that, apply that advantage multi, to give the antibiotic, the doxycycline, days, if not a couple of weeks before transport's going to occur, so you can make sure they're not going to have a reaction to it. Now, the reaction to the dying microfilaria typically happens within hours, if not 24 hours tops. Doxycycline, you don't get that anaphylactic or allergic reaction, at least not because of the heartworm or microfilaria. But it can make some dogs nauseous. And so, again, transporting a dog when they first start on doxycycline might compound that problem. So it'd be better to start those things and then wait to transport at least like 1 to 2 weeks before doing so. So that would be one of the arguments, though, that I commonly hear against using these microfilariocides on dogs, that the intention is to transport them up here. But my argument would be that if you've got that relationship established, or someone does with that veterinarian at site of origin, then and also we'll point out that when they did the studies with the Moxidect and the Advantage Multi and giving it to dogs that were microfilaria positive, they did not have any reactors like that. As I say that now, I there might have been one, but it was not yeah, I have to double check that. The point being, they weren't all reacting, and there was a fair number of dogs in the study. So it's not a guaranteed given. In fact, it's less likely to happen than not. So, or less likely to happen than to happen. So that would be, the important part for, as a rescue or shelter, thinking about that when you're thinking of transporting dogs from or anywhere that are heartworm positive into the state. So let's touch a little bit on treatment because this is also kind of important if you've brought that heartworm positive dog into the state. Again, as the American Heartworm Society, I mean, their ideal, and you couldn't see me do it, but I did air quotes, ideal method of treating heartworm. And they have this very well laid out, again, on their website, and not hard to find. Is to you weaken the adults first. So a month prior to the adulticide or giving the injections to kill the adults, you want to start them on doxycycline because again, you want to weaken the worms ideally. And then you give them the macrocytic lactone. So that any of the heartworm preventions, so that could be Heartgard, Trihearts, and Perica, or the list I have there. There's a bunch of others, as well as again the topical moxidectin and Revolution. Anything that prevents further exposure to heartworm and also will again at least help weaken the microfilaria that are circulating. Past protocols, there would be a step where you would intentionally kill the microfilaria. You'd go out of your way to eliminate them all in one fell swoop. Using this protocol, the studies have shown that it reduces the microfilaria production enough, and that the microfilaria that they produce are less infectious, that it's not necessary to do that step. It's just going to happen naturally as you are treating the adults and you're continuing to give the oral heartworm prevention. So that's step one. You want to basically you're preparing the dog to be treated. So 2 months later, so you've given the antibiotics for 30 days, and then you're going to skip a month. That's when you start killing the adults. So the doxycycline's been done for 2 months. They're going to give the first injection of a drug called melarsamine. The brand name amiticide. There's a new one out. I can never remember its name, but melarsamine is the drug. So this drug is going to kill the adult worms. The potential side effects would be pain and inflammation. The most serious side effect with treating heartworm in dogs is the death of the heartworm itself. It's on the right side of the heart. When those worms die, they do break down to some degree, but there is more than likely than not some chunks, if you will, of those worms are going to make their way into the pulmonary artery, into the lungs. And if that chunk happens to be big enough, it can cause pulmonary emboli, which are very life-threatening potentially, especially if you get a bunch of them. And so as you're killing these worms, and until the treatment protocol is completed, restricting activity is extremely important. You don't want their heart rate to get up, um, because then the blood's pumping harder, and the likelihood of dislodging a larger piece of dead worm increases. Prednisone is typically also part of that protocol. Some veterinarians will just start them right on it. I would be one of those veterinarians. Others will send it at home with the owner. So if it seems like the dog is reacting, they will start the prednisone and then, ideally give their vet a call. And then pain control, just anti-inflammatories, gabapentin, whatever the drug happens to be. There's a lot of different choices, and veterinarians have their own favorites. But those would be the three things to manage when you're treating the adults. But all the while, you're continuing the monthly heartworm prevention. I did skip one step with treating the adults. So after you've given that first injection, what you're going to do then is a month later, you're going to give two more injections spaced 24 hours apart. So 30 days after that first adulticide injection, they're coming back in. They get one injection, and then the next day they get another. And then in this particular protocol of the treatment, you finish the treatment. You're just continuing them on monthly heartworm prevention from there on forward, but you're still going to be restricting activity. And depending on, I wasn't smart enough to write down the time frame, and I was never smart enough to memorize it. I always went back to the form. But I want to say it's at least a couple of months of restricting their activity to be safe, that they don't develop a pulmonary emboli. So that would be the quote ideal way to treat heartworms, at least according to the American Heartworm Society. Um, they don't, the American Heartworm Society does not generally recommend any form of a slow kill treatment using monthly preventatives. The downsides would include the potential development of resistance. So again, we're not seeing that up here. It does happen. But the fear being that if we're using these drugs to slowly kill heartworms and it's not completely killing them, and they're still able to produce young that are infective, we could potentially be looking at developing a resistant heartworm. And the other part of that would be, to the animal, that dog itself that has these heartworms, the length of time it takes to kill adult heartworms, they're still in the heart, and it affects how the heart works. And in some cases, it can cause irreparable harm to the heart, i.e., heart failure can occur. So that would be the less ideal way of treating these dogs. And the other thing I would say, just on a personal note, having had clients come in that have adopted dogs that were, some of them didn't know, or at least claimed to not know, that the dog was heartworm positive, or they were told it was treated. Um, and either they misunderstood, the dog was actually just given an oral heartworm prevention, or they were led to believe it was treated with an oral heartworm prevention, or they were led to believe if they just keep giving the oral heartworm prevention, the worm is going to die. I just feel that it can be misleading to tell owners that. Um, but I think if a rescue or shelter, whomever is forthcoming with the owners that, hey, this is a heartworm positive dog. This is what we've done. This is what needs to be done. If everyone goes in at eyes wide open, I think that's a fair trade-off. Um, Now, having said this, there is a long list of different slow kill protocols on the American Heartworm Society website. And I can kind of summarize, well, not just the slow kill, but there's also different protocols using the adulticide therapy. And some are frequently used by humane societies just because the speed, you really want to keep a dog at the humane society for 3 months while you're treating heartworm. No, that's not good for anyone. So that's why I say air quotes ideal treatment would be that three injection protocol. But so there's different protocols outlined on the AHS's website. Um, but they come with downsides. The upsides are always balanced out by something potentially bad. Generally speaking, the bad part is the increased risk of side effects. Uh, so, so just so you know, they do exist. And I'm not under the delusion that we live in an ideal world where every rescue and every humane society is going to treat these dogs start to finish. I'm trying to keep a dog quiet in a humane society for a week, let alone 3 months. I mean, that's just not happening. So it's not realistic. So, and again, this is kind of when you go onto the American Heartworm Society's website, this is their compendium of heartworm in dogs, and it goes through everything start to finish from how it's transmitted, how to prevent it, their recommendations on how to prevent it, the different treatment protocols, side effects, again, that how to transport dogs that are infected with heartworm and so on. So a lot of great information. I would encourage you to go there if intentionally or not, you happen to have a heartworm positive dog um, in your group. So, heartworm disease in cats, I'll just touch on that a little bit. It's trickier in cats. I mean, first of all, it's hard to diagnose. They tend to only, if the heartworm can develop into adult, they intend to make only a few worms, and so it can be difficult to detect on your standard antigen test that we test most dogs with. And antibody tests can be deceiving in that a positive antibody test just means at some point in time that animal was exposed to heartworm. It doesn't mean it was still there. So there's combo tests out there that test for heartworm antigen and heartworm antibody. If you happen to get a cat that comes up positive for both, then you more than likely do have heartworm. Um, but the point here is the cats are a dead end host. Those adults aren't going to be producing microfilaria. They tend to only have a few worms. Those worms generally don't make it out of the juvenile stage. And what we find with cats isn't so much a heart issue as it is a lung issue. They get this what's called heartworm associated respiratory disease. And it's just a major inflammatory response to the juvenile heartworm in the body. And so a lot of the treatment with cats with heartworm does not center around killing the adults. And there's two reasons for that. One, there's nothing that's approved for use in killing adult heartworms in cats. And secondly, the side effects to the imidacide injections tend to be as bad as the infection itself. And so treatment really comes down to managing the clinical signs. If they have signs of heart disease, you manage that. If they have signs of pulmonary disease or distress, inflammation, you manage that. And hopefully you can manage them through the point where their body has eliminated the adult worms and they can go on their merry way. But it does often leave residual issues, whether that be in the lungs or the heart. So there is heartworm prevention out there for cats, tends to be topical. the American Heartworm Society would recommend all cats be treated, whether they're indoor or outdoor cats. So I'll just throw that out there for you, just so you are aware. Um, and just to keep you up at night, there is another dead end host that I always like to point out because it gives me the willies. But humans, there are more than a handful of cases where people have gotten heartworm, but again, it develop into an adult and they don't produce microfilaria. So it's much like in cats, a lot of it is respiratory issues, or they'll make people will make granulomas in their lungs. And from what I understand, if it's really causing a problem, you can manage the inflammation, but sometimes you have to surgically remove the granulomas. So I'm not suggesting you get yourself started on heartworm prevention, but I will say that preventing mosquitoes from getting a hold of you and attaching to you, well, it's always a good idea. So just the kind of the difference in the life cycle of heartworm and dogs and cats. On the left, we kind of went through that already. You got that full circle, anywhere from one to, well, it says 250. I've heard up to 300 worms living in that heart. Converse that to cats, 1 to 3 worms, and the cycle stops. It doesn't progress past that, even a late juvenile adult phase. So those would be the major differences between dogs and cats. So with that, that's Squirrely. He's my buddy. I found him in my garage as a little baby, and we became friends. So I had to throw that in there just because it makes me smile. I will entertain any questions anyone might have. So Dan, I will let me know if there are any.
Sure thing. So it looks like we don't have any questions quite yet. Just a reminder, folks, if you do have questions, please feel free to drop them in the Q&A box, and we can go ahead from there and getting your questions answered. Um, and while y'all are furiously typing, I'll just take a moment to plug our Facebook and LinkedIn pages, where you can get updates on future webinars. When this one will be posted onto our YouTube channel, we'll definitely put out some links on the Facebook and LinkedIn pages. But if you just want to stay on top of the latest happenings at the board, those are real good places to look. Additionally, we do have quite a few newsletters, including some that are animal specific or area specific, and those you can register for on our website. And I will drop some links in the Q&A box here in just a moment. But looks like we don't have any questions coming in, Dr. Steve. So maybe we
All
want
right.
to just let folks know how to get in touch with us. And other than that, there you go.
Yeah. Yeah.
All
So,
right.
yeah, thank you all. I appreciate your time, out of your day. You've got my name right there. That's my email address and that's my phone number. So I'll leave that up there. Again, then as Dan mentioned, the presentation will be on our YouTube channel. I'll just jump on the soapbox one more time. We appreciate the fact that there are animals in our southern state neighbors, or distant neighbors that don't get the kind of care that they might have up here. And so we certainly don't want to say we don't want dogs with heartworm coming up this way, um, because I think they can be helped. And you all are the ones that generally are doing it. So I just ask that working with your veterinary partners again at the site of origin to consider some of the at least if nothing else the Advantage Multi, and then potentially starting them on doxycycline before transport, or look at that information on the American Heartworm Society's website on how to minimize uh, potential infections from transported dogs. So on that note, I will again just say thank you one last time, and I will wish you all a good rest of the day.
All right. Thank you again for joining us. Please feel free to follow up with any questions that you may have or may have come up. as we were going through here. Oh, we had a comment. Thank you so much for the presentation and for sharing the resources. Yes, thanks for joining us, Nancy. We appreciate you. And from there, this recording will be posted on our YouTube channel, which is also linked in the Q&A box. Please feel free to follow up with us, and thank you so much for your time.